This is Nusta Carranza Ko, Assistant Professor at the College of Public Affairs at the University of Baltimore. So I wanted to just take a few moments to go over one particular matter that may or is being overlooked at the moment when we discuss matters related to the coronavirus outbreak. So we have this pandemic that is currently taking over political scenery, medical science. We are also talking about resource depletion. We're also talking about division of classes. We're talking about race, among many other things. And I think one thing that we really have to keep highlighting is the underlying factor that has to do with human rights. So I wanted to focus on the human rights aspect of the coronavirus, in particular, relating it to one norm at the international level, also known as R2P, which is the responsibility to protect. So the responsibility to protect is a human rights norm. And this is the concept that each individual state will protect their own populations from harm in the form of war crimes, genocide, or crimes against humanity. So it's generally most often invoked in those kinds of contexts, again, that deal primarily with international humanitarian crisis. So for instance, in Syria, or even in Rwanda, where we have had the case of genocide, we would be seeing states invoking this responsibility to protect, which would be more of a global intervention that takes place to address the atrocities that are occurring on the ground. What I do think is important is that even though you see more of R2P being referenced in relationship to war crimes, genocide, ethnic cleansing, and crimes against humanity, in reality, I think this is the right type of norm, perhaps, that we can even envision in a situation of a global health crisis. So the R2P argument has been made before, primarily related to the Ebola outbreak that has occurred before, where the individual state has forfeited its obligations or is unable to do or fulfill its obligations to protect its population, in which the collective community of nations has the responsibility to intervene to protect the civilians. And then at the larger level, United Nations has the responsibility with the Security Council's endorsement to go in and also address global health crises such as the Ebola outbreak. If we try to extend that idea of R2P to human rights abuses on the ground, perhaps we can also argue that if there is a denial of basic healthcare occurring on the ground, even in the context of a pandemic, for instance, this is a condition that would likely necessitate some form of social action, the responsibility to protect at the global level for the collective community of countries to intervene. So in the case of the coronavirus outbreak, particularly, I think R2P may be applicable, and we might see more applicability of R2P happening with developing countries that are likely going to be bearing the bulk of the burden when it comes to casualties, when it comes to the coronavirus outbreak. Primarily, that is because developing countries do not have the same type of resources as do developed countries such as the United States or Canada, although the US current numbers are a little bit alarming. But nonetheless, if that same type of outbreak were to occur in developing countries, you would actually see that having much more of a detrimental impact. So if you see a situation where the global pandemic is actually going to have a major impact in developing countries, where the bulk of the population is actually being challenged and without having access to healthcare or even any form of testing, perhaps that is a context in which we ought to invoke R2P and as a global community actually intervene on behalf of the citizens or the individual human beings that are being put in jeopardy. I think perhaps currently what the cases might be relevant for R2P and the coronavirus may be within the context of countries that are having a significant difficulty in terms of dealing with this matter. For instance, such as Ecuador, and perhaps in the future we will see some countries within Africa also going through major moments when the world would need to question whether or not we would actually need an R2P invocation for the world to act. The one caveat I think that we ought to consider within this context, however, is that the world itself is experiencing a pandemic. So this is kind of an unprecedented global health crisis. We are not dealing with the disease outbreak in one particular area, but around the entire world, which means that maybe perhaps this would be the challenge that the responsibility to protect might be facing at the international level, because there may not be enough countries that may be able to respond collectively to even address this healthcare crisis that is occurring. And perhaps we might likely see this norm not functioning because states are in dire conditions. But the hope is that would not necessarily be the place. So that would be the association that we would make between R2P and the coronavirus outbreak.